right, cranial nerves. Number one is olfactory. Its function is smell. Nerve type is sensory. Number two is optic. Function is vision. Nerve type is also sensory. Number three, oculomotor. Its function is most eye movement, and the nerve type is motor. Number four, trochlear. Function is movement of the eye. Nerve type is also motor. Number five, trigeminal. Function is face sensation and mastication, and it's both motor and sensory. Number six is abducens, I think it's called. Its function is abducts eye. Nerve type is motor. Number seven is facial. Its function is facial expression and taste, and it's motor and sensory as well. Number eight is vestibulocochlear. Function is hearing and balance, and it's a sensory. Number nine is glossopharyngeal. Its function is taste and the gag reflex, and it's both sensory and motor. 10 is vagus. Function is gag reflex and parasympathetic innervation, and its nerve type is both sensory and motor. Number 11 is accessory. Its function is shoulder shrugs, and the nerve type is also motor. The last one, 12, is hypoglossal. Function is swallowing and speech, and the nerve type is motor. All right, the axillary nerve, roots go from C5 to C6. Its motor function is that it innervates the teres minor and the deltoids. Its sensory function is that it gives rise to the upper lateral cutaneous nerve of the arm, which innervates skin over the lower deltoids. All right, tibial nerve, its nerve roots from L4 to S3. Its motor function is that it innervates the posterior compartment of the legs and the majority of the intrinsic muscles on the foot. Its sensory function is that it innervates the posterior compartment of the leg and the majority of the intrinsic foot muscles. Radial nerve, nerve roots from C5 to T1. Its motor function is that it innervates the triceps brachii and the extensor muscles of the forearm. Its sensory function is that it innervates most skin of the posterior forearm and the lateral aspect of the dorsum in the hand and the dorsal surface of the lateral 3.5 digits. All right, ulnar nerve, nerve roots from C8 to T1. Its motor function is the two anterior muscles of the forearm, the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, and the intrinsic muscle of the hand. Sensory function is the medial 1.5 digits and the associated palm. All right, tibial nerve, nerve roots from L4 to S3. The motor function is that it innervates the posterior compartment of the legs and the majority of the intrinsic muscles of the foot. Its sensory function is that it innervates the skin of the posterior lateral leg and the lateral foot and sole of the foot. Right, femoral nerve, nerve roots from L2 to L4. Motor function is that it innervates the anterior thigh muscles, the hip flexor joint, pectineus, iliacus, and sartorius, and extends the knee, the quadris femoris, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Its sensory functions is that it supplies the cutaneous branches to the anterior medial thigh, the anterior cutaneous branches of the femoral nerve, and the medial side of the leg and foot. Sciatic nerve, nerve roots from L4 to S3. The motor function is that it innervates the muscles of the posterior thigh, biceps femoris, semimembranosus, and semitendinosus, as well as the hamstring portion of the abductor magnus, and indirectly innervates the muscles of the leg and foot. Sensory function indirectly innervates the skin of the lateral leg, heel, and the dorsal and plantar surface of the foot. Deep peroneal nerve, nerve roots from L4 to S1. Motor function is that it innervates muscles in the anterior compartment of the leg and some intrinsic muscles of the foot. And its sensory function is that it supplies the triangular region of the skin between the first and second toes.